And then along comes this virus. What's the first thing you remember of it coming across your consciousness? When was the first time it sort of peaked for you?
The first time I registered was reasonably soon after it became public knowledge. So you had the notice from the Wuhan Health Authority around about 31st of December. And within a very few days, the World Health Organization said something public about that. And then there started to be a series of developments, announcements. We began to see what was happening in Wuhan. So by the time I left to go to the World Economic Forum in Davos, which I've been doing most years for a lot of years now, in mid-January, we were well aware that something was happening in China, which was of potential great significance.
Mm. And of course, we'd had other pandemics which had been relatively contained, including SARS in Asia. Was there a sense that this was going to be more than that? Or, what was the feeling, especially among those of you, especially you, who are so well connected internationally?
I think up until the point I heard more in detail about the discussion in Geneva, which was when I was at Davos in that basically third, fourth week of January, people were taking it a bit lightly. It was something happening in China as far as people knew. But when I was at Davos, at the end of one of the health-related meetings I was at, we were asked, would you like to stay on to hear about the emergency committee meeting of the WHO on the COVID-19 virus? And of course I stayed. And at that point we heard that the emergency committee had not recommended that there be a public health emergency of international concern declaration issued, and that this would not be the end of the matter. From that time, I was very focused on it. I went on to the United Kingdom. By that week, Wuhan had finally been shut down, and we began to see those quite dramatic hospital scenes. So from then on, I knew this was serious. And by the end of January, I think the 30th of January, Dr. Tedros was able to get a recommendation from the emergency committee of the WHO that there should be a public health emergency of international concern declaration issued. But it took a trip to China to remove obstacles to that. And that was a week of inaction which the world didn't need.
Mm-hmm. Were you privy to lobbying that was going on, or discussions or pressure to speed things up at that point?
At that point, I was an informed observer because the Partnership for Maternal, Newborn and Child Health, which I chair, is headquartered in WHO. So, of course, word percolates out to me from those who work within the building. The biggest insight I got was when I was in Geneva myself at World Health Organization on the 19th of February. That was after the Public Health Emergency of International Concern declaration, but no one was doing anything. And as our independent panel was later defined, February was the critically lost month when there was the FEIC, as we call it for short, declaration, but no one really reacted much. On the 19th of February, for the launch of the Lancet Commission on the Future for Our Children's Health, the group of us had lunch with Dr. Tedros, and we asked about what was happening with COVID-19. And he said to us, and this had a chilling effect on me, he said, quote, "There is a narrow window of time to avert a pandemic, but it is closing fast." That was the 19th of February. We went away thinking, this looks bad. Then on the 11th of March, when Dr. Tedros was getting so little response to the international emergency, he used the pandemic word. Now, the pandemic word had no legal meaning in the international health regulations under which the WHO operate with respect to pandemics. But it needed that word to galvanise world attention, because who relates to a FEAC? Who relates to a public health emergency of international concern? They're lost after the first couple of words. But pandemic, the P word, sends shivers around the world. From then on, we started to see more action. But too late.
Yeah. It was a way.
It was away. It was really away by the end of January, but could have been contained if very serious measures had been taken immediately.
What was it like to travel during that time? Was there any concern or fear?
So I was in Geneva. I'd heard this. I had as I recall, a strategy retreat with the Partnership for Maternal, Newborn and Child Health. We were taking on board that things were serious in China, but we didn't know really how far beyond this. Already there was a case report in Thailand, etc. I went on to the United States, stayed with a colleague in California. The last day I was in Sacramento, the first case in California, in that city, actually was reported. I thought, I'm glad I'm leaving here, and went home in that last week in February. But now we know that there was a lot more COVID around than we imagined, and I felt that I was just a step ahead of disaster. I then in March carried out a commitment to go to Chile with the assurance of the think tank colleagues there that it was okay to come. I arrived in Chile. They announced the next day they were locking down. I said, I'm getting out of here. I stayed one night, pre-recorded the presentation that was supposed to be live, got on the flight that day to come home. And so I incurred the first sort of voluntary self-isolation, as it were, or required self-isolation in that week in March, before the lockdown.
Knowing what you did and seeing what you had overseas, when you came back here, what was your sense of how we were preparing? Did you have an assessment at that time?
So I think the New Zealand government did many things right at an early stage, quite early in February. Around the 3rd, I think we stopped travel from China for foreigners. We let New Zealanders come home and they were told to isolate. But we progressively tightened the border. By the time I came back from Chile, it was just before the lockdown. So I was on the 14 days of self-isolation when the lockdown actually came in. My sense was that people were scared. They were scared. And they were looking for whatever advice they could get. Everyone could see by then for themselves what was happening. And remember, also by early March, northern Italy was in agony. Old people were dying in significant numbers in the northern Italian hospitals. People knew this was real. And they already by 28th of February had seen the first case come to New Zealand.
Just before I talk, I just wanted to go back to your previous experience of dealing with these sorts of emergencies and pandemics. But can we just sort of finish off that early phase by, we went into lockdown, or the borders were shut, we went into lockdown. Was there a moment for you we've talked to many people about, well, for instance, Susie Wiles said she cried when it was announced that we were locking down, because she felt like the right thing is being done. We've got politicians who are making the right calls backed by science. Was there a moment for you in that very early phase where you sort of, the enormity of what was going on struck you, or?
I knew this was the most significant public health event for New Zealand since the 1918 flu. It was big. And I was relieved when the lockdown was announced, because we had no other tool. We had quite early statements out of the Oxford research team that worked with AstraZeneca that they were fairly confident they could get a vaccine by the end of the year. I thought, gosh, that's optimistic, but actually it was delivered, and people in the United Kingdom were getting their first shots of that vaccine then. So we knew that help was on the way, but it was nowhere just around the corner. So we had to cope in the absence of a vaccine, and that meant the lockdown was really the only option. Otherwise, you were leaving the most vulnerable to die. And actually, although we know that people with pre-existing health conditions, non-communicable diseases, were most vulnerable because the disease was attacking the vital organs of heart, lungs and kidneys, it also struck quite randomly. We all know of people who were perfectly healthy and even quite young who got hit extremely hard by COVID. One young friend of mine, fit, healthy young man in his 30s, was told to bring his family for the last time home from London. I mean, this is traumatic. Now, he's alive today, but with a lot of long COVID. So it struck the elderly and the health vulnerable, but it also struck quite randomly as far as I could see.
Well, there was so much we didn't know.
We didn't know.
Yeah. Can we just go back to your previous experience? You're a former Minister of Health, Prime Minister, of course. In those jobs, did pandemic preparedness planning come across your desk?
Yes. Pandemics have been around my life a long time. The AIDS pandemic, still classified as a pandemic by UNAIDS. When I was a young health minister, we were in the early stages of the response, and thank heavens for the steps that Michael Bassett took as Minister of Health in the 84 to 87 period. I knew one of the people who was first to die in New Zealand from HIV. He was a neighbour of Dame Kath's and a celebrated Auckland chef. And that really brought it home to you. And I remember those early days of the AIDS pandemic when people were just completely caught unawares. And it needed a 101 public health response. And thank heaven New Zealand had that response. We went into Public Health 101 with extensive public health promotion, very much promoting the use of condoms. We were very aware of the key populations who were most impacted in Western societies, men having sex with men, people who inject drugs, and our sex workers. And we acted to support all to become safer from this threat. So we had the world's first public needle exchange, something to be really, really proud of. And it persists in some form to this day. So when I became Minister of Health, this was a hugely live issue. And interestingly, all those decades later, who were some of the people who were at the forefront of the COVID-19 response? People like Michael Baker, who'd been young academics and medics, public health medics, when the HIV response was being handled. So as Minister of Health, of course, I was very much on board with this and proud of what we did. Then when I was Prime Minister, the SARS disease developed and attracted a public health emergency of international concern declaration. As it happens, New Zealand only ever had one suspected case in April 2003, but nonetheless, we went into full mode. SARS recorded about 8,000 cases globally with a death rate of near 10%, which is rather deadly. So we had to be ready. It didn't hit its worst here, but we did a review as a government on how we'd handled it, and we concluded that we needed purpose-fit legislation. And you will see on the books the Epidemic Preparedness Act 2006, which came out of our government's review of the response to SARS. We needed more powers to act than we had in the Public Health Act, which was old legislation. And that act proved to be immensely helpful to the New Zealand government response when COVID-19 came. So I feel proud of that. Now, after being PM, I went to UNDP. And at UNDP, we had an HIV and health program. When the Global Fund to combat AIDS, TB and malaria was set up, it was set up outside the UN system, outside WHO. This wasn't necessarily wise, but that's the way it is to this day. And the initial assumption was that all countries, low and middle income, with challenges with these three diseases, would receive direct funding. But it quickly became apparent that a number of countries were in no state to receive direct funding because there wasn't the capacity to handle it, and there may have been issues with transparency and corruption. At which point, the Global Fund came to UNDP, which was the largest country-based organisation within the UN, which had backup admin systems which could receive money, account for it, and see it went to the purpose for which it was appropriated. But to do that, you had to build up quite a specialisation. So I was really proud of the work UNDP did in that area. Mm-hmm. And over time, we improved the way we administered it. And we did a lot of good in a lot of places and still do to this day with this money. So that kept me very current with HIV. So then when I was at the UN, Ebola came.
Yes.
December 2013, first case in Forest Guinea. And the UN response to it was poor initially. WHO dropped the ball. It was very much in the province of its regional operation headquartered in Brazzaville. That wasn't a good response. Eventually, the UN centrally stepped in. There was a special health mission, very much supported by the Obama administration. And everything in the three affected countries, Guinea, Liberia, Sierra Leone, was repurposed. I went to the three countries in February 2015 when we were starting to think about the recovery phase, and the UN was to host a major recovery pledging conference. And it was a sobering experience for me to meet people in those countries who'd lost everything. Mm-hmm. Every family member lost everything, their jobs, their incomes. Met people who'd recovered who still carried the stigma which was associated with it. It was sobering. But I also saw how each of our agencies repurposed everything they did to fight Ebola. There was nothing more important because as long as Ebola was there, those countries could not recover at all, and their economies were devastated. Society was devastated by what had happened. We then held a very successful pledging conference at the UN in 2015, another thing I'm really proud of.
So in those roles, going back to those early days of being Minister of Health, you had really seen the effectiveness of public health tools, repurposing administrations to be able to deal with these emergencies, and the importance of actually getting on top of them and dealing with them.
Yeah, public health 101. Try to contain, be able to have good surveillance, detect, isolate, treat. This is the continuum, and it's what was done in the 1918 flu pandemic. It needs to be done with every pandemic threat. Today we still have cases of Mpox, we have Marburg virus, we have still cases of Ebola breaking out in East Central Africa. So we have the avian flu, which resurfaces from time to time. There's any number of pandemic threats out there, and they have to be identified, contained, treated, so that you don't let this become far bigger than it need have been.